Contrary, no. I think the ayes have it. The ayes have it.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Josh Newbury.
Thank you, Madam Deputy Speaker. I am very grateful to have the opportunity to lead this debate on NHS urgent care in my brilliant county of Staffordshire, and particularly on what that means for my constituents in the towns and villages of Cannock Chase. I would like to start by paying immense tribute to the dedicated staff who work in our NHS and in social care, from district nurses and general practice through to care homes and A&E departments. The passion and expertise they bring enriches lives and saves lives. When I was elected, I knew there were many local issues I would need to get to grips with quickly, but amongst many priorities, urgent healthcare was one of the very first I knew that I had to campaign on. It's something that my constituents have raised with me frequently on doorsteps, in emails, at surgeries, and in conversations with local clinicians. It goes right to the heart of whether people feel confident that our NHS will be there for them when they need it, and that our area is well served. Before being elected to serve Cannock Chase, I worked in the NHS myself, in communications, not in a clinical role, but that experience has very much stayed with me. It means that I approach debates like this with a great deal of respect for the people working in the system, and with an understanding of just how complex it is. I know how difficult decisions can be, how stretched staff are, and how long it can take to move from strategy to delivery. But I also know that delay and uncertainty has consequences for patients, for staff morale, and for public trust. For my constituents, uncertainty around access to urgent care has become an all too familiar experience. The minor injuries unit at Cannock Chase Hospital was temporarily closed in March 2020 so that staff could be redeployed to the COVID wards at New Cross Hospital. At the time, that decision was entirely understandable and widely supported locally. The NHS was facing an unprecedented emergency and staff stepped up in extraordinary ways to protect lives. At the same time, it was said that this closure was temporary and that the Royal Wolverhampton NHS Trust planned to reopen the MIU once the pandemic-related workforce pressures eased. But nearly 6 years on, that temporary closure feels anything but temporary. In fact, 2 years after the closure, in March 2022, there was significant fanfare around the possibility of a reopening that summer. Many residents understandably took this as a sign of progress, but ultimately, nothing came of it. After more than 2 years of radio silence, in August 2024, the Staffordshire and Stoke-on-Trent Integrated Care Board announced a wholesale review of urgent care services across the county in light of the new national standards around urgent treatment centres. Whilst the proposals are for other hospitals in Stafford, Burton-upon-Trent, Lichfield, Tamworth and Stoke-on-Trent to have their urgent care facilities upgraded to meet these UTC standards, they also include the permanent closure of Cannock's minor injuries unit, which would effectively end the remaining hope amongst my constituents and others in neighbouring constituencies too, that urgent care will come back to our area. The reasons given included a belief that need from the Cannock Chase area was already being met by other nearby hospitals, and above all, a refusal from the Royal Wolverhampton NHS Trust to support urgent care provision at Cannock Chase Hospital. They just aren't interested, was a comment made to me by a member of the ICB staff. The way these proposals were communicated locally was, in my view, very poor, and I've been very frank with the ICB on that. The reaction to the people who did see the ICB's document was understandably one of huge concern, particularly amongst older residents, people with chronic conditions, and those who can't drive. The ICB only planned in one public engagement event in my constituency, and it was on an afternoon in the weekday, and even that attracted far more people than they'd planned for. Although many didn't get to hear about the event, the room was still packed and very frank views were given. On my request, the ICB did hold a second event in an evening, and I'm told that was well attended too. We were told that the ICB expected to take its final proposals to health scrutiny at Staffordshire County Council in the spring of last year, with a full public consultation in the summer if the committee deemed that to be necessary. And yet months passed without any update, adding to the uncertainty and frustration locally. Now I want to be clear that I'm not standing here to criticise the ICB for the sake of it. I meet regularly with them, and at those meetings we have serious, detailed discussions about patient flow, demand, the workforce and outcomes. I understand that good decision-making in the NHS takes time, but I also believe that prolonged uncertainty comes at a cost. Every month that passes without clarity leaves patients unsure where to go when they need care, staff unsure what the future holds for their workplace, and communities feeling that decisions are being made far away rather than with an understanding of local reality.
My honourable friend give way.
Yes, I'm happy to give way.
I thank my honourable friend for giving way. I note what he's saying about his integrated care board, and I do have very positive meetings with them. However, there is a similar situation affecting the town of Rugby that I represent, whereby the urgent treatment centre is nurse-led, and we very much want there to be a doctor-led treatment centre, and there is a review currently underway. But I and my constituents are simply not aware of the review's end date, and that really does cause the kind of concern that you are talking about around services. Your honourable members.
I thank my honourable friend for his intervention, and actually I saw a post that he made on Facebook earlier today actually about this very matter. I know that he's fighting very hard on it on behalf of his constituents, and I hope, as I hope that my integrated care board listens to the concerns of my constituents, I hope that that is reflected also in Coventry and Warwickshire, and that he can get some progress on that hopefully doctor-led unit. But for the last 6 years, people in Cannock Chase have had to travel to Stafford, Lichfield, Walsall or Wolverhampton for care that they would once have accessed locally. That's not simply an inconvenience, it undermines the objectives of urgent care reform. It increases pressure on neighbouring hospitals, and it pushes more people into A&E, exactly the opposite of what the urgent care review itself is supposed to achieve. But most worryingly of all is those who are not seeking care at all. Not everybody can drive. Not everyone has access to reliable public transport, particularly in places like Staffordshire. When patients are faced with long, complicated journeys for what should be straightforward local treatment, many simply put it off. And then conditions worsen, complications develop, and people ultimately end up needing an ambulance for something that could have been treated earlier, more cheaply, and closer to home. At the engagement events and in conversations with me since, constituents have told me that the MIU was a lifeline when they didn't need A&E, but their GP felt they needed to go to hospital. Cannock Chase Hospital is very close to a bus station, and most people locally can catch a single bus to reach it. By contrast, travelling by bus to MIUs in Lichfield, Stafford, Walsall or Wolverhampton can be difficult, often involving multiple changes and long journey times. As a result, many of my constituents are paying for taxis instead, which is a significant financial burden. This issue becomes even clearer when we look at the demographics of my constituency. It has a slightly older population than the national average, with more than 19,500 residents aged 65 and over, around a fifth of our population. Almost half of those older residents, more than 9,300, are living with a long-term health condition, a higher proportion than we see nationally. These are the residents who are most likely to need timely, urgent care, who are more vulnerable to deterioration if treatment is delayed, and who often face the greatest barriers when services are not available locally. The NHS's own data shows higher attendances at both surrounding MIUs since ours closed, but not by the total amount of previous activity at Cannock Chase Hospital, backing up what residents have been telling us about not always seeking care. We can also see how these pressures play out in practice at nearby hospitals that many of my constituents rely on when local urgent care isn't available. Royal Stoke University Hospital, whilst not in my constituency, is a key part of the wider system, and it serves residents from right across our county. In the final quarter of last year alone, the hospital saw more than 33,000 A&E attendances, and over 6,800 patients waited more than 12 hours to be admitted and discharged. That's more than 1 in 5 attendances, double the national average, and places the hospital amongst the most pressured in the country.
Would you allow?
Yes, absolutely.
Madam Deputy Speaker, I mean, the Royal Stoke Hospital is in my constituency, and one of the things that they tell me is if it wasn't for the Hayward walk-in unit up in Stoke-on-Trent, or Leek Hospital, or Stafford MIU, the A&E would simply fall over, because naturally in Staffordshire people gravitate to the A&E when they want help, and the fact that my honourable friend's constituency is without an urgent treatment centre is something that does have a ripple effect across the county. So I wonder if he will join me potentially asking for the Minister when she is winding up, if there's any data that she has that would demonstrate the impact that the lack of facility in Cannock is having on neighbouring hospitals, and what the impact that is therefore having on the services that are experienced by my constituents and the constituencies across the county.
I very much thank my honourable friend and fellow Staffordshire MP for his intervention, and he absolutely highlights a critical point, that every part of our NHS can have a knock-on effect for the others, and the system needs to kind of work as a whole. We can't just focus on individual services. We have to see how it works in the round, which is what the review is trying to do. But of course, many of us feel that it's perhaps not hitting on what it needs to. And I don't raise these figures to criticise staff who are working under immense strain, or the government, which is making strong progress on addressing those pressures, but simply to underline a simple point. When local urgent care is unavailable, demand doesn't disappear. As we've heard, it is concentrated elsewhere. Making sure patients get the right care in the right place is absolutely critical. Too many people end up in A&E not because they need to be there, but because there is nowhere else for them to go. Perhaps in the past, our MRU was not always used for its intended purpose, but often even that was a symptom of failings in community care. Now, urgent treatment centres will be a vital part of the fabric of our NHS between primary care and emergency departments. But not having that service for a population of over 100,000 people is a real challenge, and it weakens the wider system. Now, in the 17 months since the review of urgent care was unveiled, I've had many conversations with our ICB about urgent care more broadly, as have GPs, counsellors and campaigners. I know that they are putting in place services that make good on the government's commitment to shift care from hospitals out into the community. So I welcome the introduction of a wound care local enhanced service, which recognises that wound care was previously a key reason for patients accessing the MIU, even though their home is a better place for that care to take place. This shows that sustained conversations around our local health needs and inequalities are starting to translate into results. I hope that building on this, Cannock Chase can be a forerunner in the rollout of multidisciplinary neighbourhood teams. The health inequalities we sadly have locally, coupled with the distance to many secondary care services which I've referred to, means we would benefit hugely from this model of supercharged community care. Better than having to catch a bus to Lichfield or Stafford would be heading to Cannock Chase Hospital, but even better still would be getting that care at home. That's what I am calling for and will continue to fight for on behalf of my constituents. There are areas where Staffordshire is performing strongly. Urgent community response services are exceeding national targets. Winter planning has helped stabilise hospital stays during periods of peak demand, and vaccination programmes are having an impact on admissions too. So this is an argument against reform. It's an argument for consistency and for fairness. If urgent care reform is about reducing avoidable A&E attendance, improving patient flow and ensuring equitable access across the system, then Cannock Chase cannot continue to remain an outlier. But crucially, this isn't just about rhetoric, and the government is making huge strides in the NHS nationally, backed up by reform, by investment and by a determination to make sure that people get the right care in the right place at the right time. This is why I welcome the investment already being made into Chadsworth Medical Practice, Rawnsley Surgery and Red Lion Surgery in my constituency, which will make a huge difference to people's everyday experiences of the NHS, that they can actually see and feel. But strengthening primary care doesn't remove the need for local urgent care. One simply can't replace the other. So my ask today is a simple and constructive one. I am not asking the Minister to preempt the outcome of the ICB's review. I know that she cannot do that. And I'm certainly not arguing against the reform of urgent care that prompted this review. What I am calling for is clarity, fairness and alignment between national ambition and local delivery. If we believe in shifting care out of hospitals into communities, if we believe in reducing avoidable A&E attendance, if we believe in equitable access to urgent care, then Cannock Chase must have that as part of its future too. I hope too that 2026 can be the year that sees an expansion of urgent care back into my part of the world, and I'd urge the Royal Wolverhampton NHS Trust to make better use of Cannock Chase Hospital, which many residents feel remains underutilised compared with what it was under the former Mid-Staffordshire NHS Trust. I'd welcome the Minister's assurance that local voices will continue to be properly heard, that decisions will be communicated clearly and promptly, and that the government will work with the Staffordshire and Stoke-on-Trent ICB to ensure that communities like mine are not left without urgent care provision. Urgent care, at its simplest, is about whether somebody with a broken wrist, a deep cut, or a worsening infection knows where to go and can actually get there. I look forward to continuing to work constructively with the ICB, with the Minister, and with colleagues across the House to make sure urgent care in Staffordshire truly works for the communities that we all serve. Thank you.
Smyth.
Deputy Speaker, and it is a pleasure to respond to this debate, and I'm grateful to my honourable friend for securing it and for the constructive way in which he has raised the important matter of urgent care in Staffordshire. And can I say it's always good to have more proud NHS non-clinical bureaucrats in this place to pursue these issues, because this government is also clear that the patient should expect, as he says, high standards of care, and we recognise this has not always been the case in recent years, with too many people waiting too long to access the help they need. But we are determined to change that, and we're taking serious, sustained action to restore timely access to high-quality urgent care across the country. Our urgent and emergency care plan for 25-26 sets out that clear path to strengthen urgent care outside hospitals so that patients can access timely, appropriate support without needing to attend A&E unless clinically necessary. By increasing the number of patients, as he said, treated closer to home, scaling up our urgent community response teams, providing rapid 2-hour care, expanding virtual wards to provide hospital-level treatment at home, and growing multidisciplinary neighbourhood teams that intervene early and prevent avoidable deterioration. We will support patients to book into the most appropriate urgent care service for them, whether via 111 or the NHS app. And we are using data from shared patient care records and digital tools to support better triage, join up services and anticipate pressures before they arise. This is backed by £2 billion of investment in NHS digital infrastructure. We're also investing £250 million to strengthen same-day emergency care and urgent treatment centre provision, helping systems across the country avoid unnecessary admissions and support the same-day diagnosis, treatment and discharge of patients. And turning specifically to my honourable friend's constituency, I know that the work he's done with local NHS to ensure that his constituent voices are heard. And in preparing for this debate, Madam Deputy Speaker, I also met with the local NHS to understand the situation he describes better. They are taking steps to strengthen urgent care capacity and improve patient pathway in line with the policy outlines that we have made. But I am also aware of the concerns around the closure of this minor injuries unit. As he said, following the closure during COVID, the ICB undertook a review of whether the service should be reopened, and that review concluded that demand previously met by the minor injured unit was being met elsewhere. The NHS in that time has strengthened the wider urgent care offer for local people, including enhanced primary care. He talked about wound care, it's very important to local people. GP out-of-hours services, access via 111, urgent community response services and access to urgent treatment centres in other locations. These arrangements ensure that patients can receive timely and appropriate care. The system is also, as we've set out, developing, and as he talked about, neighbourhood integrated teams. These will be scaled up, delivering more proactive and preventive care to intervene earlier and reduce avoidable deterioration. And these teams, as he outlined, are central to shifting care out of hospital and towards community care support. Urgent treatment centres do play a vital role in this wider urgent care system, providing that timely assessment and treatment for patients whose needs are urgent but not life-threatening. The system is therefore ensuring that there are treatment centres to meet national standards, improving consistency and simplifying access for the public to help divert activity away from Type 1 emergency departments and ensure more patients receive the right level of care closer to home. And in response to my friend and his neighbour, the member for Stoke-on-Trent Central, I think it is important that the MPs in the area do understand that wider movement of capacity, and we'll make sure that they have that information. I'm pleased to say that Staffordshire has become the first system in the Midlands to establish a 24/7 integrated care coordination centre. This provides a single access point for clinicians, coordinates urgent community services and prevents unnecessary A&E attendances. Nearly half the calls to the service are now successfully redirected away from hospital, helping patients access help more quickly and easing the pressure that we've heard about on A&E departments. They've also increased capacity in urgent community response services, virtual wards, same-day emergency care and intermediate care. Urgent community response performance is particularly strong, with over 78% of referrals seen within 2 hours, which is well above the national ambition of 70%. And additional clinical resources has been put in place through the winter to meet rising demand and support resilience. This work sits alongside strengthened pathways for people that my honourable friend outlined, particularly people who might be elderly, who experience falls and who may be frail, needing end-of-life care, people in care homes. We need to ensure that those patients in particular receive that timely and appropriate support, and I think, as he said, have the confidence that the service is there for them in that time of need. Together, these services are helping manage demand on A&E departments, improve patient flow and make best use of the urgent care capacity across Staffordshire, including in Cannock Chase. And those improvements, as he rightly outlined, must be felt by the people of Cannock Chase, and indeed to ensure that demand is well managed and support people across all of Staffordshire, as my friend, the member from Stoke-on-Central, also highlighted. In terms of the longer term, we are planning for the future. Our 10-year health plan sets out that long-term vision for urgent and emergency care reform. A central priority is to shift that care, as I've said, from hospitals into the community, and this will be driven by continuing the expanded urgent care through urgent care community response, virtual wards, those rapid access clinics and better coordination through neighbourhood-based care. Our plan is working because in the past 18 months the government has invested a record £26 billion in the NHS, delivered over 5 million additional appointments, cut waiting lists by 312,000 and launched the 10-year health plan to deliver more care in the community. We know there is more to do, but our investment and modernisation are making a difference, and the NHS is showing those clear signs of recovery. And thanks to these steps, this winter ambulances are arriving faster, A&E waits are shorter and more patients are being treated closer to home. And in closing, I want to add my comments to my friend, the Honourable Member for Cannock Chase, to pay tribute to the NHS staff across Staffordshire and across the country. Those doctors, nurses, paramedics, healthcare assistants and support staff continue to show exceptional commitment, often in the most challenging circumstances, and they do deserve our thanks and support. We know the NHS is under pressure, but this government is taking decisive action through our urgent and emergency care plan, our winter preparations and our long-term reforms. Through those, we're putting the service back on its feet and ensuring patients receive timely, high-quality care. As we make the NHS fit for the future, making the changes we need to move care out of hospital into communities, making that switch from analogue to digital and from sickness to prevention, we have to communicate better with patients and the public, as he has clearly outlined this evening, and that includes keeping MPs, such as the Honourable Member who's brought forward this debate from Cannock Chase, well informed of those proposals.
I do thank the Minister for giving way. I just briefly wanted to highlight the fact that one of the perverse things we have in Staffordshire is my own constituency is serviced by the Royal Stoke Hospital, as is Stafford, which is headquarters within the ICB that funds it. Some of the places that the Minister has mentioned this evening, Cannock and Burton and Tamworth, their hospitals are actually smaller hospitals linked to a much larger acute hospital in a trust that is headquartered outside of the ICB. This is a perversity for cross-border invoicing, and also does sometimes make us wonder what the incentive is for some of those trusts. Is that something potentially in the future we could meet as a group of MPs to discuss with the Minister?
My honourable friend was one of the first through the door when I became the Minister to share with me some of those issues around Stoke. And so when I met with the system today with my map in front of me to point out exactly some of the journey times for this issue, his comments were in my mind. And I absolutely, as I said, I think it's really important as we move the system, as is recognised on the best clinical evidence, that we do take local people with us. And for me, that does include making sure that MPs are well informed of the proposal and the rationale. And as we've heard today, MPs are willing to be very constructive advocates on behalf of their constituents with local systems. And I do welcome that engagement, members, on this issue. And I'm very happy to continue working with my honourable friend and with other colleagues in Staffordshire and with NHS leaders on how we can further strengthen those emergency care services for people in Cannock Chase and indeed across Staffordshire.
The question is that this House do now adjourn. As many as that opinion say aye.
Aye.
The ayes have it. Order, order.